there's so many good treatments now.
Oh, I think we're live.
We are live. Hello, everybody. We're just chit-chatting.
Hi. Let's see. Let me
Now
get to
we've got
you.
to go live on Instagram, which is always a hassle for old Dr. Q.
You've been doing a really great job, Dr. Q. Give yourself more credit.
I don't think people know how old I am. I'm 103.
I think only you think you're old. I think that's what that is.
Well, you know, if you take care of yourself, which
Which you do
since
a good job of.
yeah, you are what you eat. I just saw a real interesting article about diet. So I don't see that we're
All
on
right. I
sickle
am
cell.
I'm live on Sickle Cell 101 on Instagram.
There we go.
And then
Okay.
hello.
Ask me to join. I'm on.
Okay. Let's see. Do you see how fast that was? Look, you should get the request now. Hi,
Yeah,
everyone. Happy Friday.
I sent you a request. Up there we are.
Hello, hello, hello. Happy
Hello,
Friday.
everybody. We are live
We
on
are live on
Instagram.
Instagram and we're also live on YouTube. So if you have to hop off because you want to use your phone for something else, we're on YouTube. So if you just go to Sickle Cell 101 YouTube, you can hop on the live there and you won't miss one single question. All right.
And you can ask any question you want.
You can ask any question.
This is my thing for this Friday. Try to stump me, which you
Try the
can't
what?
do. But give it a try. Ask me a really hard question.
Oh, okay. Yes. So challenge accepted. And I'll put myself in the running for that too. I'm going to try and think of a really, really difficult question for Dr. Q here. Let's see here. Why don't you all share where you are tuning in from? I love to see where you all are, and maybe I can live vicariously through you.
Hello.
All right. So let's go ahead and get started. Oh, I already see a question. Are you guys both doctors? I am not a doctor. No, just Dr. Keith Quirolo. He's our expert. And then I'm what we call what is it? Lived experience expert. So right. I have expert in living with sickle cell disease.
But I tell people always, if you have sickle cell disease, you know more about sickle cell disease than I do. And as a disclaimer, I'm not a hematologist. I'm a pediatrician. So I have a long, weird history, but I ended up at UCSF Children's Hospital, and I was the director of their sickle cell program for 20 years. And I also did transfusion medicine and stuff. So I missed the job a lot. So. Oh, they want to know what kind of
it just goes to show you don't need to be a hematologist to be a sickle cell expert.
No.
You can be like Dr. Quirolo, who just took a liking to sickle cell and just knows everything about it now.
Basically what you have to do is you have to be a compassionate, empathetic person who's willing to shut your mouth and listen to the people who have sickle cell disease tell you what their problem is. You can't put that's the key. And you have to be interested enough to go to meetings and learn about sickle cell. You can't take, sickle cell is really complicated. It took me a couple of years when I left my private practice and started taking care of people with sickle cell. It took me about 2 years to figure out, or at least feel comfortable that I knew something about sickle cell disease. Yeah, there's very few people who do that, I know.
Okay.
Have to think about that.
Oh, sorry, Dr. Q.
Okay.
I'm seeing some questions roll in. You guys are already on point with the questions here. What type of sickle cell do you have? I have SS. So I have sickle cell SS. I believe the answers, if you have any questions about SS, then let me know. Here's the first one that I would like to ask. Dr. Q, what do you know about I guess the shortage of medications happening right
Um,
now? What can you say to that, and what advice can you give somebody living with sickle cell who might be, hit with that?
a lot of people are impacted by shortages, and um, there's a couple of the main reason why there's shortages of some medications is because they're generic. So if you don't know, I will tell you, pharmaceutical companies make a ton of money selling medications. And they have sort of, it's not called a patent, but they are entitled to be the only person, they're the only company to make a medicine that they develop for, it can't, I can't, I don't know personally, but it's like 10 years. At the end of 10 years, then then other people can make generic drugs. And there's ways to get around that. But once people are making generic drugs, then the price plummets. Um, and so everybody wants to make a lot of money. So, for instance, the drugs, I just read an article in New England Journal of Medicine, and it was about syphilis. Sexually transmitted diseases in this country are going down, except for syphilis. Well, that's weird. Why? Because the drugs that treat syphilis, which are penicillin related, they're penicillin but different types. They're generic, and nobody wants to make them. So, for instance, there's not a shortage. There are no drugs, or the drug that they would like to use to treat infants who have been exposed to syphilis isn't made anymore. So you have to use a different drug. The drug for adults is in very short supply. Normal saline that you see hanging if you ever get admitted, that's in short supply. Albuterol that you use for your asthma, that's in short supply. But these are medications that are that where the patent or whatever has run out. What we really need in this country, and maybe this should be something that we're all lobbying, is that the United States government start making these generic medications because there's no money in it. So the government has money that they could use to make penicillin. Hydroxyurea is really cheap. It is a generic drug. So that's the basis for your problem of not having medications. But it's not sickle cell, it's everything.
What can you do? What can we do about that,
I
the
think I
shortage, and
think
how?
you I think it would take all the CBOs, people with sickle cell disease, physicians. I don't see this like at ASH and stuff that people talk about it, but in terms of doing it, I mean, if everybody lobbied their representative in the federal government, your senator and congressperson, um, to try, I'll tell you the pharmaceutical companies have a lot of money. There was just a big article. They pour money into Congress and into CBOs and people who want what we were just talking about to stop it. They don't want they want to be able to make money for, forever, basically. But so there's a lot of money and a lot of people who are against um, the government interfering with commerce or whatever. The reason why our healthcare system is a mess is because the insurance companies lobby Congress people, don't change the laws. Don't make Obamacare too good because that will put us out of business. So you have to sort of like go this far, but not that far. And this is a capitalistic system. So everybody wants to make money, and money is where that pushes the economy. And so a lot of people and Congress people get millions of dollars from companies that want them to pass or not pass
I have a
legislation.
question. So, I mean, if I'm somebody who can't get pain medicine because there's a shortage, for example, what can I guess I as an individual do around that situation?
I think you actually, as an individual, you can write to your representative in Congress and tell them that you're concerned about this, and get your friends
But what
or
if I
who.
need it? What if I need the pain medication that day?
Then you have to do, I forget what medication it was, but then you have to call around to other pharmacies.
Oh, so you kind of search for
You
who
search
has
around for it. I
availability.
saw a news article about there was a shortage of albuterol or some kind of asthma medication, and people literally spent hours and hours a day calling
Wow.
to try to get this medication. Pain medication, yeah, it could happen with hydroxyurea, other
Yeah.
Oxbrida, whatever. I mean, it could happen.
That's kind of a scary thought, to be honest. Yeah.
Yeah,
Yeah.
right now, all the new medications are going to be available at at the markup price for a decade or more. But hydroxyurea and other medications, when you go into the hospital, the medications that you get all the time, normal saline, D5W, that kind of stuff, those are in relative short supply. And hospitals have started making their own, compounding their own medications if they can't get them on the open market. So it's a big
Okay.
deal.
So you have to kind of go out fishing. My suggestion, if to me, medication takes priority over a lot of other stuff. And so you can just take the day to, devote to calling around or, seeing who has these medications. I would say it's well worth it. And if I were to go to my local CVS today and they said, hey, we don't have your medication, I wouldn't be on live right now. I would just block everything out. I need to find my medication.
Yeah.
Where is my medication? And yeah, so it sounds like it's a hustle, to be honest. But our systems
This
are so broken. What else can we do? What
the
else
other
can we
the other
really
thing
do?
that sounds weird is go to the same pharmacy all the time and have a relationship with your pharmacist.
And I do. They
Yeah.
know me.
Yeah, so they know
Yeah,
who you
we
are.
always
And
talk about developing relationships with your doctors, but your pharmacist. And we have a pharmacist on the team. Maybe I should get Dr. Boateng here. But he's like, did you know you can do this with your pharmacist? Did you know you can do that? I said, no, I had no idea. So maybe we'll have a live
we should have him
with
come on.
Steven, because he be telling me all the tips and tricks. And sometimes I have a medication and I was like, oh yeah, I'll refill it when I refill it. He's like, no, don't play with this medication. You need to go get it filled today. So it's really nice having his insight on that. So maybe we'll pull him on live for,
Yeah,
for
and he
some
knows
time.
the details about how long drugs are available when when their patent or whatever you call it runs out, how pharmaceutical companies can extend that, and how to get generic drugs and which drugs are not available. I mean, he's really so
Somebody's
the,
asking,
the
what can you
reason
do with
why
your pharmacist?
yeah, the reason why you want to because pharmacists, all like, say you go to CVS, Walgreens, or whatever, they know what's available in their whole system. So they
Yeah,
could
they can
say,
tell you which
we're,
CVS to go to.
yeah, so like we're in the Bay Area. We live in San Jose and close to Berkeley, a little place called Albany. And so if you go to your CVS, they might say, oh, hey, the guy over in Alameda has that. Or I will call Alameda or somebody near and find out if they have that. And then you can go get it. And if
Yeah.
you always get your medications at the same pharmacy, like CVS, Walgreens, or whatever, those prescriptions usually go back and forth. So you can go to any CVS or any of those big
Yeah.
companies, and you don't have to get a new prescription. It's in their system. So you just go to a different
I've forgotten my medication when I traveled one time, and I went to the CVS across the country, and they were able to fill it for me with the emergency 3-day supplies. Because I didn't know that until Steven told me. He is like, if you forgot your medication, you can get a emergency 3-day supply. And I was like, and they actually gave me more than 3 days worth. So yeah, there's little tips and tricks. I'll bring them on. I can't remember any right now, but yeah. I want to, this is a good question, and this is more of a philosophical question here. Any tips on how to actually live a decent life with sickle cell? I'm going to pair that one with, this person said, I have no energy and do nothing for the day. I'm filled with mental anguish. When I have a productive day, I'm filled with physical anguish. How am I meant to live? So these are some really, really deep questions. And, it really is to each their own. For me personally, I don't know. I don't know how, this is why they call us warriors, honestly. This is exactly the reason, because we're dealing with so much. I think my advice is you have to learn how to be happy in pain, and you have to learn how to be happy in fatigue. So it's like, I'm on the couch, like I can't even move my arm anymore at this point. I just turn on some TV, some comedy, and laugh. Even though I'm in pain, even though I am in fatigue and I can't do much, it's just, I think people think you either have to be in pain and sad or happy, and they separate the two of those. But really, it's finding happiness within discomfort is really the trick to me to being happy. So it's making it work. It's making it work to however that works for you. And like I said, this is really philosophical and really, easier said than done. But, if I'm so tired and I need to rest and everything, but I want to do something that I like. I told y'all last week a little secret of mine. I like watching vacuum videos. They relax me. It's ASMR. I have like a vacuum ASMR playlist. And, I don't move a finger except for my thumb. And that's scrolling to watch my vacuum videos. And it brings me joy. I know it sounds weird, guys. And I like I said, this is because I have pica, because I have sickle cell. So it's not my fault. It's not my fault. Sue me. It's not my fault that I like weird stuff. It's sickle cell, and I just chalk it up to that, and that's what it is. But long story short, really, it's not you're in pain and not happy. And there is times, right, where you're in pain and not happy, right? But then, like, when I'm in pain, I'm joking with my husband, like I'm cracking jokes. I'm telling him, don't make me laugh that hard because ow, that hurts. And it's just really just finding a way to be happy when you are uncomfortable or when you are in pain or fatigued. So that's kind of how I go about it. I also try not to, because, if I start feeling sorry, and I think we all have every right to feel sorry for ourselves. Honestly, like if you feel sorry for yourself, you have that right. You really, really do. And sometimes I'll go there. I'll be like, this really sucks. Like, this is horrible. This is that. But I try not to. I try not to get that deep within my thoughts. Try and keep everything surface level and light. I'm not sure if that's the right thing to do, to be honest, because maybe I think all of us should see therapists in a way. But for me, I just try and keep it light and cute, and keep it pushing. And that's how I try and have a decent life with sickle cell. I'm a mom. I have a 9-year-old daughter. She brings me lots of joy. The people around me bring me a lot of joy. Make sure you're surrounding yourself with people like that. What else? Y'all know I watch vacuum videos. I get to do Sickle Cell 101. Yeah, I like, and I will say I wouldn't trade lives with somebody else who doesn't have sickle cell either. I think having sickle cell is fulfilling in itself in a way. So that's how I go about it. Um,
Everybody
Someone
should
said
be.
when I'm in pain, I watch ocean documentaries to
Yeah,
calm me
I
down.
saw
I
that.
love that. I love that. And I watch documentaries too. I love documentaries. So yeah.
If you're on Instagram, I don't know what you see on YouTube, but the comments are very interesting. The way people cope with sickle cell. Of
Yeah, yeah.
course,
Y'all,
of
y'all
course,
should share how you cope.
as a doctor, what I think, should you be on hydroxyurea? Should you be on, are you
Mm,
optimizing your medication? So when I started, there was zero medications. There was nothing. Now there's like 4 or 5 that you can take together. So you need to talk to your primary care doctor about, is there a medication or a combination of medications that would make me feel better, that would increase my hemoglobin and do so. Nothing's 100%, but it could make a difference in your life for sure. The medications nowadays are phenomenal if you take them, the way you're supposed to.
yeah. How do you guys deal with having sickle cell? How are you guys able to still be happy and live with sickle cell? I want to read some of your responses throughout the rest of the live. So um mm, 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 mm. I'm kind of just going through some of these and making sure I haven't missed anything. Okay. So next question I have here, we have to do our AVN stuff. So this person says, and yeah, I say that because we get a question like pretty much every single live about AVN. And I'll just let you know, in case you guys have any follow-up questions, I had AVN in my right hip and I got a hip replacement. So I'll go ahead and this question is a little bit different, Dr. Q. Any complications when someone gets surgery for AVN? So what could be a bad outcome or any complications from getting surgery?
Okay, so if you listen to this, you realize that I read New England Journal of Medicine a lot. So in New England Journal of Medicine, they looked at how to prep somebody for surgery, and the study looked at it, and iodine was the medicate, the pre-op, sterilizing your skin so that you had fewer infections. So infection is one of the things that would be pretty serious if you had a hip replacement and somehow it got infected. And when you have a foreign body inside of your body, like a hip replacement, which is metal, that is a nidus, or that's where bacteria can grow because your immune system isn't part of the surgery, part of the prosthesis that you get for a hip replacement. So that's a serious post-operative complication. You can have bleeding during a surgery like that. So if for some strange reason the doctors getting you ready for surgery didn't say, well, maybe we should have, 3 units of blood available because they have antibodies to blood and it's kind of hard to find their blood. Maybe we should just ask the blood bank to get a few units of blood that maybe we know won't need them, but if we did, we wouldn't be able to get them, that day or something like that. So bleeding is another thing. I personally have, I don't do surgery, but the surgeon for one of my patients had a really serious problem with bleeding for whatever reason, and that person needed 3 or 4 units of blood. But we had a great blood bank, and we could always get blood for that. Another thing that could happen, would be that the prosthesis goes into, if it's a hip replacement, goes into your femur. So if that got loose for some reason, which it does over time, but if for some reason it was loose, that would be a problem. The other thing that's kind of on the person who got the hip surgery is if you didn't cooperate with your physical therapist and you didn't do the PT, they get you up that day. You wake up and they say, okay, sit up at bed. I want you to get in that chair over there. And if you said, no way, I'm not doing that, that wouldn't be good either, because Cassandra can tell you the physical therapy after you get a hip replacement is intense. And you really have to do that in order to get all those muscles working again and get things going. Because if you don't, then you can end up with some, disabilities on some level. The other thing about a hip replacement is you can get one at any time. Eventually, with AVN, the head of the femur actually fuses right into your pelvis, and you can't move. You don't have pain because nothing's moving, but you can't sit down normally. You can't. You've got a really severe limp, etc. But even though that's fused, you can still get a hip replacement. So, and the hip replacement is up to you in a way. It's when the pain is so bad you just can't stand it anymore, and people have been telling you, hey, you should get a hip replacement for a year or so, and you finally decide, okay, it's a big surgery, so I don't blame people who don't jump right into it. But you sort of have to psychologically prepare yourself for that. And it's sort of a landmark, oh my goodness, my sickle cell has led to me getting this surgery. So there's a lot that goes into that psychologically to prepare yourself for it. What do you have to say about hip replacements, Cassandra?
Me,
Yeah, you had one. I have no idea.
yeah, I had a total right hip replacement. Let me just see. I'm trying to scroll through here to see if there's any follow-up questions around hip replacement in general. I waited probably about 3 years until I decided to get my hip replaced, and that was because I was like, I'm not getting a replacement at 23 years old. Like, no. But when I got it, the pain, subsided immediately after Dr. Q's right. I had to get up and do physical therapy. And the thing about me is, if I'm going to do something, I'm going to do it right so that I can get the benefit. Like, I'm not going to do things haphazard or, half whatever. So when they told me I had to commit to physical therapy, I was all in, because it's like, why did I go through and get this whole hip replacement if I'm not going to do the work afterward to make sure that I can walk straight and actually use it the way it's intended to use? And I was like, plus, I think I got my hip replacement at 25. So I was like, plus I'm 25 and I still want to be cute. And I, still want to be mobile and this and that. So I'm going to put everything that I have into physical therapy. And I did. So that's what I would say about that is if you commit to this, even if you decide to take a new therapy and you commit to taking that new therapy, like hydroxyurea, you have to follow through and actually do it the right way to make sure that it works or doesn't work for you. And so I'm a very forgetful person. I set an alarm. I take a couple pharmaceutical. I have something. I take a beta blocker because I have cardiomyopathy. I take hydroxyurea, and then I take another sickle cell drug. And I set a timer I set an alarm every day. Otherwise, I'm gonna forget to take it. And I don't. And this is so I'll push snooze on my alarm if I'm not in a place I can take the medication. And that's how, I guess, dedicated I am to making sure I take my dose every day, because I'm not going to take it 2 days a week and then get half the effect and then just say, oh, it doesn't work for me, or, oh, this or that, I want to make sure that I've done it right and make sure that I've done everything that I can, and yes, it doesn't work for me, or yes, it does. But at least I know that I've done everything that I was supposed to do. And if I find out it doesn't work for me, I can say I've tried and move on to finding other solutions or whatever. So I have that approach with everything kind of sickle cell related. Like if I commit to it, it's gonna be like the very best for me in regards to that, because I really want the benefit. And I really want to make sure that I give myself every opportunity for that benefit. So same with the hip. I did physical therapy. I'm not a gym girl. I'm not. I got I got a doctor's note to get out of PE. I didn't have to run the mile. I remember one time they made me, and I was like, "Ooh, you're gonna be in trouble with my mom. You guys are about to be in trouble with my mom. Y'all making me run this mile or walk this mile? Okay, you'll hear from my mother." Um, so it really was a challenge for me doing physical therapy. But I committed to it because I need to have a nice working cool hip. I do have chronic pain around my hip. So like if I like if the weather's changing, I'll feel it in my hips. So I have chronic pain. But a lot of people don't. A lot of people are just fine with their hip replacement, and they don't have any issues with it. I've had my hip in for 10 years, 11 years now this year. So um it still works. It's still good. So yeah, that's me and my hip.
So, you know, having your hip, having a hip replacement and having it still be functional at 10 years, you know, I'm not an orthopedic person, but I've heard that's a little bit unusual. But if you listen to Cassandra, it's because she really takes good care of herself. And if you don't do the physical therapy and you know, you kind of do things halfway, that doesn't work too well in medicine. And with your medications, people have spent a long time looking at what dose you should be taking and how often. And there's a lot of science that goes into that. So if you try to kind of like, well, maybe I don't have to take this every day or something like that, then it's just not going to work. And then you can't, like Cassandra says, then you can't say 6 months later, hey, this doesn't work for me if you're only taking it half time or something like that. So it's some of it's on the person who has sickle cell to do what they and then you can, if you do that, then you can honestly go to your care provider and say, hey, you know, I've been really taking this medication. And with hydroxyurea, they can tell. They can look at your counts and determine, number one, whether they think you're taking it, and you might be, but you're on a too low dose or too high dose. So the counts that you get when you get your hydroxyurea determines whether the dose should be working or not, like what's your fetal hemoglobin, how big are your red cells. Um, so that can help the doctor change the dose if you need to. Or, you know, if they're an accusatory type person, they could say, hey, you're not taking your meds, but you are, but they have you on too low a dose. So.
Okay. Next question I see here is, can you please explain about pregnancy and sickle cell, how it's managed? This is another question we get a lot. Yeah. And I know I've been promising you guys to get, you know, I guess a reproductive expert on this, but Dr. Q does a fantastic job as well. And so, you know, while that's in the works, Dr. Q, what advice would you give somebody who is pregnant or is thinking about getting pregnant with sickle cell disease?
So let's say, well, if you're thinking about it, then you have to learn about it. You have to talk to your primary care doctor. You know, I'm thinking about having a baby with my partner. What do I need to do? What are the resources available in my community? So if you have sickle cell disease and you're planning on or are pregnant, you need to have a high risk OBGYN, and you need to have a high risk a neonatologist. Sometimes they're kind of the same person does both, but that's really important because people who have sickle cell disease who are pregnant, that is by definition, that is a high-risk pregnancy. So you need to have a team, and you need to have a hematologist to be communicating with those people about how you're doing with your sickle cell disease. So having a baby with sickle cell disease, Cassandra has a little girl. So it's not, there's things you have to be aware of and have to take care of yourself. The problems, one of the controversies about pregnancy and sickle cell disease is because if you're on hydroxyurea and you're planning on getting pregnant, then if you're on hydroxyurea, the recommendation is that you stop taking the hydroxyurea. People who have sickle cell disease who weren't intending on getting pregnant, but there were, they missed their period a few months and then they realize, oh, I'm pregnant, and they're still taking their hydroxyurea. There's never been a documented case of a child born of a mother who was taking hydroxyurea early in pregnancy had any problem. So that's not great, but don't worry that because of the hydroxyurea, something might be wrong with your baby. So then you have to go to these people, and there has to be a team approach of how you're going to be taken care of. And the controversy is around transfusion. So some people think that as you progress in your pregnancy, all women who are pregnant, your blood volume increases pretty substantially. So all women, whether you have sickle cell disease or not, their hemoglobin is going to go down. And if you have sickle cell disease, it could really go down. There's a controversy about when to start transfusions, whether you should start transfusions, and what criteria you use to begin that process. Personally, this is my own personal opinion. I'm not telling anybody what to do, but I recommended in the third trimester, if somebody was anemic, that they should probably start monthly transfusions, or at least talk to the OBGYN, that we would get together and talk about it to make sure that the person who is having the baby had the best outcome. There are complications with sickle cell and pregnancy. You can have anemia, which causes more pain. People during pregnancy can have more pain than they usually have because of having a baby is not nothing. So people can have acute chest syndrome, following the birth. They can have other problems. I had a young lady who had a pulmonary embolus after she had the baby. Some of the amniotic fluid, the placenta is part of your circulation, and some of the amniotic fluid got into her circulation and she had a pulmonary embolism. So there are a lot of rare things that can happen. But generally speaking, if you have really good health care and you do what you're supposed to do, you can expect to have some more problems than someone who doesn't have sickle cell, but if you're managed and you have good doctors, it should go okay.
Okay. My pregnancy was actually probably the healthiest I've been. I didn't have a bad pregnancy, but I don't think, it really is to each their own, right? There's not enough research around pregnant women or pregnant people with sickle cell disease. And so I always say the best indicator is your health history. Do you go to the hospital on a monthly basis, or, like often? Or are you going to the hospital maybe once every couple of years? What complications you have? And so it really is an individual thing. And knowing my health history, I knew I got hospitalized maybe once every 5 years. as an adult. I'll say that. As a kid, I was in the hospital every month. Last time I've been in the hospital, last time I've been admitted was 2017, and that was on a trip to Indonesia because I went and caught a virus. And so I don't have a lot of events. And so I didn't expect to have a lot of events when I was pregnant. And, you know, that was a little bit, that kind of gave me a hint to how my pregnancy could be. Now, I might have not have had any problems and then got pregnant and then have a problem every step of the way. And that could honestly happen as well. But I always like to say, consider your health history first, you know, as an indicator of what your pregnancy might be like. Of course, like I said, there isn't enough research around pregnancy and sickle cell. And so it really is guesswork a lot of the times, which is scary. And then, you know, we're Black in America. And so there's also that whole, you know, healthcare providers not treating us. I don't mean to laugh about this, but healthcare providers not treating us well. And you know, as a result, you know, a higher rate of mortality, maternal mortality. So it's everything you have to consider. It's a lot to consider. But my pregnancy went well. I have a sister who has the same genotype as me. She has 3 kids, and her pregnancies were a lot tougher. She was in the hospital a lot more than I was. So, you know, we had just different manifestations of pregnancy. I think I was followed by both a OBGYN, perinatologist, and did actually end up having to get induced at 37 weeks because I started to develop preeclampsia. So only towards the end is where, you know, things started kind of getting a little bit shaky. But they induced me at 37 weeks, and I have a healthy baby. Well, she's not a baby anymore, she's 9. But I have a healthy girl. So that was my experience. But you know, my sister, you know, I saw her go through pregnancies, rolling into the ER, her not getting medication because she's pregnant, and they want to, it's like, oh, do you protect the mother? Do you protect the baby? And it's actually quite complex, you know? And so just be sure to keep that as a consideration if you're looking to get pregnant, because it is an uphill battle, I feel, for most people getting pregnant. I hear some good pregnancy stories, I hear some bad ones. So it really is dependent on you, and nobody can really tell you or give you kind of any indication of how your pregnancy will be. So that's the sad part. You kind of gotta take a risk, but at least make it an informed decision. And, you know, look at your health history, talk to your doctor, look at what the probability is of you passing on sickle cell, especially with both you and your partner's genotype, all of that. So
the other thing is, it's you need to have doctors who know something about sickle cell disease. So
yeah.
you know, Cassandra lives in the Bay Area, where there's a lot of, no, you know, there are people with sickle cell disease. There's a sickle cell center. So there are physicians who have taken care of people who have sickle cell disease who are pregnant more than once. So and there's a lot of communication between the doctors at the sickle cell program and the OBGYN. And so there's a lot of crosstalk. So just, you know, it's hard depending on where you live, but, you know, like in Cassandra's case, they saw she was having a problem and they took care of it, and she did okay. But you do need to have good doctors. If you don't feel comfortable with your doctors, then you don't have a choice, but you should, if that's the case, you should maybe make some changes.
Next question I have. These are some really great questions, you guys. I've never seen this question coming, so I really want to ask it. Do you experience mood changes in terms of being really mean? Dr. Q. Oh, there's actually a lot to say on this because I've had nurses say, "Oh, you're really nice for a sickle cell patient." Like, give me backhanded compliments, and I use that as a opportunity to teach. Right? It's like, well, do you know why people may not be nice? Because they're in a lot of amount of pain and this and that. And I know people take offense to that. And I do kind of too. But I'll kind of try and teach. So what is your response for mood changes maybe associated with sickle cell and being mean?
Well, mental health is a big deal for Black people. There's a whole kind of mystique around it, and I'm reading a book right now called Madness, which is really well written. It's really a good book about a particular segregated mental hospital during Jim Crow in near Baltimore. And it's opened my eyes to some of the problems with mental health care. But I think if you have mood swings and you're sometimes really depressed, sometimes you're really angry, sometimes you lash out at people, or you personally just feel like I can't deal with this anymore. This is too much for me. Then you should really seek out some kind of counselor. And it can be a professional like a psychologist, or probably psychiatrists don't do one-on-one too much anymore, but or it could be your pastor, your minister, your best friend, your mom, somebody who you really trust, and you can just put it all out there. Hey, look, I'm really having a hard time. A mental health professional would be the best because they don't have any, they're kind of a neutral person, and they're willing to listen to you and give advice that should be pretty non-biased. But the thing, though, that like Cassandra was alluding to, most people who have sickle cell disease, the vast majority are Black. And trying to find a therapist, so psychotherapy is different than medicine. You want to be talking to somebody who looks like you, who's had your experience, and kind of they don't have sickle cell, but at least they know what it's like to be Black in America. And if you're white and you're looking at me and I'm your therapist, you're going like, dude, you don't know what I'm talking about. And it could be true. So if you could possibly get a therapist who looks like you and has had your experiences, that's really important, but it's really difficult. In California, it's easier, and there's actually a CBO that finds Black therapists for their patients or for the people who are involved with them, but that's not easy. Therapy is a weird kind of it's different than medicine. I'm a white guy, but I think I do pretty good taking care of people with sickle cell. But if I was a therapist, right up front, you'd have to really examine where you were coming from. If you were a white person taking care of Black patients, that would be a big deal. Anyway, that's my thoughts about it. But if you really want to know something about the history of medicine and what goes on behind the scenes, this book called Madness is really, you probably, if you're Black, it's no surprise to you. But for me, it's an interesting historical, if you want to know how Black people were treated at the turn of the century, it's very interesting. And the author is a great writer, and she's a Black journalist who started looking into this when she was in college, and it's taken her like 10, 15 years to write this book. It's very, very good.
Yeah, I think it's your every right to be mean because most people don't understand that pain, but also they just don't understand that pain, right? And so therefore don't understand why you're being mean. And so it's kind of a vicious cycle when it comes to that type of thing. And so I have mood changes. But I think it's probably more to deal with like my period than anything. Like my husband always knows You know, hormones, they're very real. Like people don't talk about hormones enough. Anyways, and so with that combined with sickle cell, it is you know, sometimes hard to control your mood. I would say in regards to that is, you know, if you are in this space, maybe if you're feeling up to it, kind of just explaining to people why, you know, you're acting, or maybe even after the fact, right? Especially if these are people that you live with you and you love, you know, just really sharing your experience with them to help them understand where you're coming from so that nobody takes it personal. And so sometimes I'll like give a snappy answer to my husband, and I'll like realize afterwards, I was like, I'm sorry, I'm in pain, you know, and he gets it. Um, in a healthcare setting, especially, I always, my goal is, you know how like a pregnant woman comes in and she's allowed to be as mean as she wants, you know, like she's allowed to cuss you out, she's allowed to, you know, like flick you off, whatever. That person's just allowed to do anything. And healthcare providers will still be so gentle, so nice, you know, because they understand that she's in labor or she's about to have a child. I want sickle cell patients to be treated that way, where it's just like, regardless of how I'm coming in, you know, if I have sickle cell, to give me grace and to treat me like you would treat a pregnant woman. Like my aunt told me, like she cussed out a nurse and this and this and this and that when she was pregnant, and they were still so sweet to her. And I was like, wow, I wish we got that type of treatment. Truly and honestly, like I wish we were allowed to be in pain. Like, and you know, uh, a lot of us will attest to this. Sickle cell crisis is worse than child labor. So if they're allowed to be in child labor, they're allowed to be rude and this and that, we should be allowed to act however we want to act and still get really good care. Now, this is in a perfect world, right? And we don't live in a perfect world, but that's something I'm really pushing for, you know, healthcare providers to know the amount of pain that we're in, and to be able to treat us better, you know, just by knowing a little bit more about sickle cell. So I see a comment here, sickle cell doesn't get the proper awareness and it's sad. I don't understand why. I don't get it either. But that's really what we're trying to push for, is making sure that at least more healthcare providers know about sickle cell. You get two types, or at least this is what I consider two types. You get people who don't know, but are willing to learn, right? Or you'll get people who don't care, in which that's where the law should come in and make them care, or like hit their pockets or whatever. But it's people who don't know or don't care, I feel like, that we face. And unfortunately, that's just the way things are right now, and just hope for a better future for everybody.
So the other type is the person who thinks they know and they really don't.
Oh, yeah. How could I forget? Yeah, yeah.
That's the person who says, I've looked at your CBC and
I
I
know
don't
all
think you're
about sickle
having pain
cell.
because your CBC would be this or that or whatever.
And that was a question
That's
we got,
really
Dr. Q.
annoying.
That was a question we got at the hospital. What was it? Can you still be in a crisis with normal blood levels? And you know, there's a lot of doctors that'll tell you otherwise.
So there actually is no marker for pain for anybody, and people with sickle cell in particular, that you can get in the lab at the hospital. Your CBC is going to look the way it always looks, even though you're in pain. There's nothing on that list of things that they look at your blood count that is going to tell them, oh, this person's in pain. There is a doctor named Samir Ballas who's unfortunately passed away, and he spent his entire career taking care of people, adults with sickle cell disease, and he was an expert in pain. And he actually has a chart where there are some changes during a pain episode, but they're so minute that someone just picking up a CBC and looking at them would have no idea. It wouldn't look any different. You have to believe the patient. You have to believe the person who's telling you they have pain. And if they have sickle cell disease, of course they could be having pain. They have sickle cell. Give me a break. So, and the other thing is, you just treat the pain. You're not gonna, the worst thing that could happen is they didn't have as much pain as they said they did, or whatever you think. But if you treat the pain, then you're doing the right thing. And then, then you could figure it out later what's going on. The other thing is, you can't just treat pain and think, oh yeah, this person has sickle cell, we'll just give them opioids. That could be something else. So as a doctor, part of your job is to look at the patient and say, oh, hey, you're having chest pain and it's right over here. I think we need to get a chest x-ray. You might have acute chest syndrome. You have a fever. So, it's not just a reflex, oh, we're going to give opioids because this person has sickle cell. If you have pain and you think it's not the kind of pain you usually have when you have a pain event, you need to tell that to the doctor. I've got this pain at the right side of my stomach, right underneath where my ribs are. That could be like gallbladder disease or something like that. So somebody asked what the book was that I was talking about. I don't know if this will show up, but that's the book right there if you're on YouTube. And that's the author. And it's really, I read the introduction and I just thought, I don't know if you can, yeah, there it is. So that's really a good book. If you can Google it, just put Madness book. And I read the introduction and I was just like, wow, I got to read this book.
But who's the author?
Her name is Antonia Hilton, Hylton, Antonia Hylton. And she's a longtime journalist. She's gotten awards, and I can see why. She's just a really good writer. And this is personal for her because in her family, there was mental illness and it was a secret. So she never knew, that things were going on. And when she was in, like I said, I think she was in college, that she became interested in this and then looked it up. And she's gone to talk to people who were there, people who worked there. She's looked at all the records. Interestingly, what she said was, in other segregated mental hospitals in the country, they burned the records. And so there's no records of other hospitals where they took care of people with sickle cell disease who had mental illness. And even in the hospital that she looked at here, a lot of the records weren't available. No, the things that went on there were sort of what you'd expect would happen in the turn of the century America. For instance, the patients built the hospital. The first patients were all men because they built the hospital brick by brick, window by window. They dug the foundation, they mixed the cement, because it was thought in those days that work would make you happy. So they put all these men to work to build the hospital. Then when the hospital was built, they put them to work in the fields, and they were selling the products, and it's an interesting story. It gives you a window into what was going on at the turn of the century, which, some of that, I'm 76 years old, so I was born in 1947, so that wasn't a long time from when I was born, and it went into the 50s, so it's not ancient history, it's history that I can really relate to because I'm old. And some of your parents are old and they know what's going on, and your grandparents especially.
Hopefully it is on Audible.
I just came out. It may not be yet, but it will be at some point.
So this question was sent in through the stories. At my hospital, I have a care plan that says no opioids, but they work best. Can they do this?
What? They have a care plan that says they're not supposed to get opioids? Well, by definition, that is not a care plan. That is a uncare plan. If that is what your primary care doctor has written for your care plan, then you need to sit down with that person and why, I've got sickle cell. Why do I have this crazy uncare plan? And then maybe, go from there. But that's not a care plan. A care plan is this person has sickle cell disease. They always get 3 milligrams of Dilaudid up front, and then they get it, assess them at these intervals, and you do this and this and this. And you have whatever it is that Ketorolac or whatever it is, you get along with it. I mean, a care plan is like how to take care of this patient. So because you have to think about it, the ED doctor, they don't know anything. I mean, they don't take care of people with sickle cell disease. They take care of all kinds of stuff. So they would love to have a note from a doctor signed that said, this is what to do. This is the recipe. They would say, oh, wow, this takes I don't have to think about this. I'll just do this. Although some doctors say, oh, wow, that's too many opioids. I can't do that, So, yeah, look, yeah, that's absurd to find a new doctor. That is kind of crazy, though, I must say.
All right. Somebody said, actually, as a follow-up, I think my care plan needs to be reconstructed drastically. I don't know how to go about it. How do you go about building, if you don't already have one, building a care plan, and if it needs to be changed, changing it?
A care plan is something that it's an agreement between you and your doctor and maybe a social worker or somebody else who's involved in your care. You have, if you're an adult, you have a history of sickle cell disease. People can look at your medical record and they can see at this point, you came into the emergency room, you got this kind of treatment, and you went home. That's what you want to see. It's not, they didn't do anything, and you got admitted, and then something else happened, So a care plan and also things change. So your care plan should be evaluated every year. You should look at the care plan and see whether or not it's good, if it's still applicable, or if things have changed, you're on a new medication, something like that. There's a little thing that says palliative care is very helpful for pain treatment, and it can be. I just talked to a palliative care doctor yesterday about how they could, how they would intervene, or how they would fit into the idea of the care of people with sickle cell disease. And personally, I don't know what happened to Cassandra. Personally, I thought they should be people who have a care, people who want to do palliative care should probably start during transition. They should get involved with the patient during transition, because once you leave pediatric care and go into adult care, sometimes there's really issues with finding a doctor, as well as setting up your care. So a palliative care doctor could definitely help with that. As medications and treatment for people with sickle cell disease, it's really kind of changed in the past less than 5 years. So my guess is that as more medications come out and things change medically and with other kinds of therapies, that the care for people with sickle cell disease will also change.
Yeah. And I'm sorry I had to turn off my camera, guys. I have some things going on in the background, but we have to wrap up. And so I'm going to ask one more question. If there is any question that was like you needed to have answered on this live, feel free to put it in there now. In the meantime, somebody asked about avascular necrosis. We talked a little bit about avascular necrosis early on in the live, and all of our lives are saved. And so you can head either to our YouTube page or to our Instagram page. And we talk a lot about avascular necrosis. So hopefully that helps. I see somebody here that says they have a crisis. I'm so sorry. I hope you get the relief you need with the pain. Oh, I think I got my. Oh my gosh, this is a huge question. Okay. let's try it. We'll try and be as succinct. And we'll talk a little bit more, promise, about this. We actually have an initiative called Curative 101 that kind of dives into bone marrow transplant and gene therapy. What are your thoughts on the safety of gene therapy for a 10-year-old kid with hemoglobin SS?
Okay, so gene therapy, the actual, well, there's different kinds of gene therapy, but that's a more complicated. Anyway, so gene therapy is new. It hasn't been around forever. So when you start gene therapy, one of the things that they want to do is follow you for 15 years to make sure that there aren't any untoward effects that didn't appear in the first, right after while you're in the hospital, that happens late. And so one of the things, the most significant thing about gene therapy is the preparative regimen. They use busulfan. And so they have to, what they call, make room in your bone marrow for the cells that they change and reinfuse that have been modified by gene therapy. And in order to do that, they give a chemotherapy that kills the progenitor cells in your bone marrow, and so you don't make any. The new cells going in are the predominant. Doesn't kill all the cells, but the new cells that they infuse are the predominant stem cells that make the majority of blood after the transplant. So the busulfan, the chemotherapy regimen, the preparative regimen, is the most problematic. And the gene therapy itself doesn't really seem to have a problem. They're your cells, they've been transformed, but your body sees them as, these are my cells, I'm happy with it. That being all said, is that, children who get bone marrow transplants, where the preparative regimen, the conditioning, they call it, is much more intense, they do fine. The art of bone marrow transplantation, which leads into gene therapy, has undergone some really dramatic changes in the past 5 or so years. And it's much, much safer now than it was 15 or plus years ago. So even though the busulfan is a chemotherapy, it's dosed according to your weight and all that kind of stuff. The other thing is, gene therapy isn't going to be available everywhere. The people who manufacture and do the transduction for the gene therapy will only, well, my understanding anyway, is that they will only do it in centers where they have a transplant program and people who are knowledgeable about bone marrow transplant. And they also have to have a lab to do the transduction or the you know, to transduce your cells has to be within a certain area close to where the gene therapy is being done. So those are the things you have to think about. But all these things are they require some kind of consent or understanding. And so what you need to do is during the consent conference, make sure you understand everything that the doctor is telling you. I think most consent conferences, you can have somebody else there because your mind is going to be spinning because it's your child who's getting this, and you need someone there who's also listening in a different kind of frame of reference that will maybe remember things you didn't. And usually when you do a consent conference, you don't have to consent at that conference. Usually they say, think about this, come back in a week, and then we'll talk about it again and you can sign for it. So that's usually the way it goes. But bone marrow transplant is safe for children. Of course, things happen. In medicine, nothing's guaranteed. If 98% of children survive bone marrow transplant, that means 2% don't. So you just have to, the odds are in your favor, but things happen that are unexpected, and you just have to kind of set your mind into the mindset that things could, most of the 99% of the time, 95% of the time, they do okay. But there are problems that arise during these pretty intense therapies. This isn't like getting a prescription for hydroxyurea. It's a big deal. And you really have to go into it with your eyes open and be able to accept problems that occur during the time that you're getting the transplant and after. So even after a transplant, you could have issues happen. So that's my take on gene therapy and transplant.
And do you want to wrap us up, Dr. Q, with your special
I
statement?
do. So the Sickle Cell 101 exists for teaching people about sickle cell disease and answering your questions like we do on this. And so what's going on here is just information, and I'm not infallible. So I may tell you things that other people would disagree with, just what I just said. My take on gene therapy, conditioning, and all that kind of stuff may be different than somebody else. Some of the responses I get, I give you they're my opinion, so other people may disagree with them. That's the way medicine is. And I'm basically not here I'm here to give you information, not advice or tell you what to do or how to treat something, and what other people should be doing. I'm telling you from my experience and my advice. So take it with a grain of salt, and just remember that your primary care physician knows you the best. They know your medical history. They know what's worked for you, what hasn't. And so that's the person you should go to get care. And thank you. It was nice doing this. Somebody wrote, it's nice meeting you. And it's nice. I have a lot of fun doing this because this is what I love to do.
Can you guys believe we've been doing this for at least live for at least like 5 years? We've been doing this for
we were doing Instagram at my house a long time ago. It's been more than
we started the program probably 9 years ago.
Yeah.
And then Instagram got live, and then we're like, oh, why don't we do live?
Yeah.
Anyway, thank you guys so much. Thank you all for tuning in, asking those fantastic questions. You guys never disappoint. And we will be back in 2 weeks, I believe.
Yeah. We do this every first and second Friday of the month.
Somebody said, oh, yes, please join more often. We love your questions. And, just y'all want to talk and decompress, we can do that too. So Thank you guys for joining. Have a relaxing and safe weekend and enjoy your Friday.
Bye-bye, everybody. Nice.
Bye.
Have a nice weekend and a nice rest of the month. We'll see you in a couple of weeks or
Bye.
in a week.